Hey, Tony.
Hey, good morning.
How you doing, Tony?
Good. How are you guys doing?
Awesome. First, thank you for being so patient here. I know you're highly anticipated session here on renegotiating. How did you possibly do this? But before we get started with that, can you just introduce yourself to everybody, where your practice is, who your practice is, and where you and Melissa are at in the world?
So, me and Melissa, my wife, own Kinetix Physical Therapy. We're located in Gainesville, Florida. We opened 2008. We've been a part of Breakthrough since really the end of 2016 or beginning of 17. Since being part of Breakthrough, it's made a huge difference with our practice. We, went from about 950,000 revenue in 2016 and doubled that to about 1.8. 1.8 in 2018, and steadily grew. And last year we were about 2.8, and now we're in the process of opening another clinic. We should already be in it, but with construction delays, we're not in it yet. So it will allow us to double our current size of our practice and help that many more people. So we're super excited for that. But being part of Breakthrough has helped me to learn. And I tried to do this prior to Breakthrough, but just learning how to back out of being a clinician full-time and also being a business owner full-time, to be able to work more on the business, which allowed me to get more into insurance contract negotiations.
Yeah, great. So can you talk about, when did you start renegotiating contracts, just to put us on a timeline here?
So 2020 was, COVID hit. So it kind of forced me out of the clinic a little bit more as far as allowing our other therapists to see any of the patients that we had to see. I had already backed out. I was, probably 15 or 20 hours a week, but I just totally backed out during that period. I was also looking at, like everyone else, increased costs, lower reimbursements, and just not seeing the light at the end of the tunnel if we kept going that path. So trying to figure out, what can we do? We had already added cash-based services, and that's really what kind of really helped, buffer that profit margin to be, a decent profit margin still, was all the cash-based services we do. But I felt like, we're a physical therapy clinic. We should be profitable just with the PT that we're doing, without cash-based services. So what can we do to work on that piece? And then, the additional cash-based revenue just being cushion on top of that. So just looking at our cost per visit was an aspect, and looking a little closer at that, and looking at the insurance companies that we're in network with, that it's costing us to see those patients, and starting to figure out, okay, do we want to drop this? Do we want to renegotiate it? And our first try has been just going across the board and renegotiating with insurance companies. And so we've been successful. It's taken a period of time to do that. And it's also taken a period of time just to get to the right person. But with us, one of our biggest payers, and I'm not sure, Chad, if I can even mention payers. Okay.
So you can give insurance company A, insurance company B would be great.
So
you're good here. You're good.
So in insurance company B, for us was a big payer. And it was about 35 to 40% of our patient population. So we started, going after them, and it took a while, but we've been able to basically get a 10% increase in 2021, another 10% increase in 2022, and we're getting another one in this year in August. So that's when it kind of started. So that'll be roughly 30% increase from 2020 with that particular payer. And for us, that's huge because that's our big bulk. But then, looking at
Tony, back in 2020, insurance company B had a guess on what they were reimbursing per visit.
Reimbursing at that point,
yeah,
62 a visit or 64, somewhere in there.
Okay, so the 10%, 10%, 10%. If my math is right, it comes out to about 33%. So if you were at 62, you're talking about like $21 a visit more.
Right.
So you're getting up into that 81, 82, $83
Right.
a visit range.
Yeah.
Awesome.
Yeah.
Yeah.
Yep. And we need that to be even more than that, but like that at least gets us, closer to where we needed to be. And we can sell cash-based services on top of that too. So like ideally we're making 20% above our cost to see the patient. We're not there yet with them. We're going to continue to negotiate and hopefully get there. But we are doing cash-based services on top of those, visits.
Nice. One question that came in from Jason was, what are the cash-based services that you're offering?
So our main cash-based service is class 4 laser. That's the big one that we do. And we probably did about 240,000 in last year with laser. So we did a lot. We also have foot levelers, orthotics. We do some, with that, but that's not a huge moneymaker for us, but it does make some. And then we also do diagnostic testing, and some insurance companies don't cover portions of that, or like MSK ultrasound. So we just charge cash for that. So, that's another piece. And then we also have a wellness component that we have that's cash.
Great. So I heard 4 different services there that you're offering potentially as cash, and that's generating likely 300K plus a year for you total.
Yeah. Like it was about 340,000
Nice.
in cash-based services last year.
That's great.
Yeah.
Awesome. So insurance company B, you went from roughly $62 a visit up to 83. Can you give one more example, and then we'll get into the how-to? So you said that insurance company B was like 30 to 40%. Is there another one that you negotiated that would be worthwhile to see what you got?
We negotiated like with all of the commercial payers. We did negotiate, and it was, each time we got a bump was roughly 10%. So we were successful with that. We've tried to negotiate, like we were successful with B, 3 different years, and we're going to continue to push that. We've tried to do that with some other insurance companies and haven't been successful yet with that second round. But one of them, our contract was like a 3-year contract. So like we got to wait. They were actually about to negotiate, and then they realized that we were in this contract, and they could, but they decided not to. So we'll probably get a bump, the end of this year, with one of them. And then one of them, I don't know, payer U, we may just end up
insurance company U. Got it.
Yeah, insurance company U. We may end up dropping them. I don't know. We're communicating with them, but they are definitely the worst one and our lowest payer at this point. So we'll see. And we also did the same thing with 6 of our work comp contracts. It was roughly about a 10% increase. It ranged, 8 to 15%, but on average, about 10% with those insurance companies. So pretty much everybody we've reached out to, we've been able to get a bump up.
Nice. So most of the time when, we're an owner, we're thinking, I firmly believe that most of us don't try. Right. So,
right. Yeah.
And I know you and I have talked about this on stage as well, but most of us think, well, I'm so small, there's this large PT provider right down the street. Why would they negotiate with me? I'm not big enough, or we don't have enough revenue. We're not seeing enough patients. Why would they negotiate? You overcame that. Can you talk about any other barriers or pitfalls you had in the beginning about how you were thinking, how you overcame that, and like got to your first win or two there?
I think the big thing is just, you got to find that right person. Once you find that right person, you got to be persistent, and don't get like super frustrated, because you will get frustrated, but don't get like super frustrated by it. They will try to like ignore you, push you off, not respond to you. Just keep pushing. Go above that person if you're able to, or if you have a contact. Like we had, for example, payer A, and this one we were able to make a pretty significant. This was payer A, and you can figure out who this is. It was a 20% increase right away, and then up to 24% increase over so many years. so it's kind of built into the contract. But that one, you couldn't even, there was no way to even find a person to get a hold of. So I went to the person that we work with in our company that looks at different insurance companies for the group every year. So he had contacts with all these different insurance companies. And I'm like, hey, I can't get a hold of these people, and I'm trying to do this. And so he got me in touch with somebody who I was actually able to talk to, then put me in touch with the person that I needed to talk to. But like I had been talking to both of them, and that's how I got that contract negotiated. So I think you got to find the right person, and it may be other contacts that, like what I found is people that are in the insurance world, if they're shopping insurance companies for group health insurance, like they should have a contact. And so like if you can't find your provider relations person, or you're not getting anywhere, maybe they've got a contact that can help you get above that person to hopefully make some change. Because I've asked, I don't know how many times, to go take me up to the top, because I'd be happy to talk to them about the reasons why we need to get paid more. And nobody up top wants to talk to you, so like just be persistent. And what I found is with being persistent, like typically they're gonna negotiate with you. Like I said, the one that's they're just a pain. I think they're probably going to bump up another time with us, and we'll see what we end up doing if we choose to drop them.
Fair enough. So Rob Jordan had a good question in here. What do you say? So you find the person to talk with. You're in that negotiation conversation. Were you writing letters? Were you having a phone call? Were you having a live meeting? Were you sending an email? What did you deliver? And what were some of the key points of what you said to ultimately get that win?
Yeah. So like, what I did, that's a good question. What I did initially was I wrote a letter, and I kind of spelled out, all the reasons that we need to, like I need to renegotiate this contract. I'd put in there, if you wanted to use Medicare as a guideline, you can. This is what we get paid with Medicare. If that commercial payer, for example, was lower than that, then that's an easy, guideline, because it's out there, for people to see. But you can also look at like your average revenue per visit, but you got to be careful with that. I just show that for example, with payer B, like they were just low. They were low on our compared to other insurance companies and what we got paid. And I also put on there like the cost it is for us to see the patient, what it costs us to see the patient. And like if we're losing money every time we see a patient, it doesn't make sense. And then I also, in that letter, like I know that the hospital gets paid 3 to 5 times as much as we do. I put all that stuff in there. I know that the physician-owned clinic gets paid more than we do. So I'll list all that stuff out. And like, why wouldn't they want to like work with us? Because like, a bump up to us makes a big difference, but it's still not what they're paying a hospital. Oh,
you're on mute, Chad.
Sorry. Yeah.
Love it. So you started with an email highlighting where this payer was at relative to other payers in the area, at least Medicare, especially if they were under that. And also the costs. Then were you having a live phone call follow-up, or would somebody reach back out to you, or would it just fall on deaf ears? And what did you do after that? How did you persist?
So going back to that letter, the other things that I put in there are like our graduation rate, because I think that's a big key. Like if you've got a good graduation rate, like, spell those things out. And then also talk about the overall healthcare costs. Like we are very conservative, it's a very good deal for people to come to us and get better and address their problem versus continued medications, injections, surgeries, all those kind of things. So I talk about all those things. And also our specialties. I bring all that stuff up as well. And if we're growing, I bring that up, so anything to kind of plead your case for being able to get a higher rate. And like, we haven't had an increase since whenever we started this insurance company, if that's the case. but then Chad, your next question was, oh, as far as like, so email them. They most times you're going to correspond via email. Like you can ask to get on the phone, because I think it's a lot easier to get on the phone and talk to them, because like it's just like I get on the phone and talk to these people and they're super nice on the phone, but in the email it's like, oh my goodness. So if you can do that, but it's not always easy, because they don't really want to get on the phone with you.
Yeah.
You know, they would rather communicate, you know, via email.
Okay.
And the email is good because you have a track of what your communication is also.
Yeah. We have other really good questions in here, Tony. Tara asked, how did you find out what they were paying the hospitals?
Well, like for me, I just had a patient that's a friend of mine, that is a physician that, you know, that had went to the hospital, and also then decided to come to us, and he saw what we were getting paid and was like this is a huge difference, and brought it to my attention. But I already knew that, you know, I mean, I think it's pretty common knowledge that hospitals, especially like where we're at, a teaching hospital, they're paid quite a bit more.
Yeah, fair enough. Locke asked, which department do you end up communicating with, and is it their network relationship team?
Yeah, so it's provider relations. That's who you go to. You know, it's just you just want to have that communication back and forth. And again, what I've found in my experience, pretty much with just about all of them, like I almost have to like send 3 emails before I get one back. Like it's like you send an email, nothing happens. Yeah. You follow up with it, nothing happens. You do it again, and then maybe something happens. And if it doesn't, then I start trying to go up the chain a different way.
Yeah, great. Candace agrees with you. She said persistence works. It took me a year of monthly emails. Yeah, got a 15% increase.
Yeah, and that and that's been kind of the same kind of thing. Like it's not a quick thing. Work comp was much quicker than your commercial payers. Your commercial payers just drag it out. I think they just drag it out so much that you kind of give up, you know, is what they do.
What a great business strategy. Ankit asked, when is the best time to do an insurance negotiation? Did you see anything in timing?
Yeah, so you have to look at your contracts, because like say if you're in a contract for a certain period of time, a lot of times they won't negotiate with you until that period is up. And then there's also a time period that they're willing to actually negotiate and talk with you. So it's just, and that's different depending on when you sign your contract.
All right. I believe you alluded to this already, Tony. Joyce asked, what information did you provide to substantiate your request for an increase? Anything different than what you mentioned earlier? Not
a whole lot, because, you know, you got to remember, they have all of our information. They know how many patients we're seeing that has what, you know, such and such insurance, what we're billing, how many visits they're coming to us. They've got that information. So like, but what they don't have is graduation rate, you know, and you know, all of those kind of things. So like, I think putting the stuff in there that you know shows that we're making a big difference is key. And like I said, the big things were the graduation rate, going back over like the overall healthcare cost and how PT is overall saving a lot of money, taking care of the actual problem. Like if you have growth, putting all that stuff in there.
Great. Another question, what is graduation rate?
So what we do, we started looking at this since we've been part of Breakthrough. And what we do is we go back, you know, say 6 months, and you know, out of those evaluations that a therapist, you know, performed, how many of those patients completed their plan of care. And that's and our goal is 90%. We're ranging, you know, probably closer to 80-85%. But overall, that's actually really good when you look at overall statistics of what the average graduation rate or plan of care completion is for PT, for patients going to PT.
Love it. And here's a good final question, Tony. By the way, while I'm asking this question, how about some love for Tony in the chat? Jessica asked, did you have to send outcome measures?
No, nothing about, nope, none of that. These people really, it's just connecting with them and trying to plead your case, but you want to be careful how you do it. It's like, you got to realize that person on the other end, they're just being told to keep rates low, so that's their job. And you got to help convince them to help you and then go to bat for you. And like, that's what I did with the insurance A, because like they actually came to me, I shot for like a 30% increase. They came to me with a 10% increase. And then they actually came back and said, you know what? Our higher levels said, no, we could do a 5% increase. I'm like, no way. I'm like, okay, go back and ask for 20, And so that's what happened. We actually got it, but you have to fight for it, and you got to get that person to fight for you. And this particular person was like, yeah, we're paying such and such, like way more than you. And I'm like, yeah. I mean, she didn't tell me how much, but she's just like alluding to that. And that's basically the hospital. And she's like, it makes more sense for us to try to get them to you guys. Now, insurance, they deal with, that TPAO, and they don't really look at it quite the same, so it's a little harder to deal with them. But if you're dealing with the main insurance company, then, yeah.
Great. By the way, Tony, you got a lot of love there in the chat, and also you're providing a lot of hope for owners, in terms of that this is a reality and a possibility. So thank you for that. In the end, between 2020 and where you're at today, what did this do for your average reimbursement per visit? What did it do for your practice? What did it do for your group?
So like for us from 2020 till the end of 2022, and now it's about a $10 difference, but that also includes all those decreases we've had during that time with Medicare. So like, even though we've had decreases, we've overall increased our revenue per visit, just the PT portion of it, by about $10. And that's going to increase even more by the time some of these other things start kicking in again. So we're hoping by the end of the year, it's another maybe $3 or $4, so, but over time, that makes a huge difference. And it makes a big difference when you start looking at volume of patients.
Yeah. Love what you're doing, man, with the Kinetix team. Thank you so much for being here. And also check out the chat for all the love that everybody gave you. This was great.
All right. Awesome. Well, thank you. We appreciate it.
Thanks, Tony.
All right. Thank you.